we are going to have a panel discussion focusing on the potential of counseling and family therapy in tackling substance abuse. The panelists in this panel discussion would be Professor T.B. Singh, who is the Professor and Chairman, Department of Clinical Psychology, IBHAS, Delhi; Dr. Jagdish Kaur, Chief Medical Officer, DGHS, Ministry of Health and Family Welfare, Government of India; and Dr. Atul Ambekar, Assistant Professor, National Drug Dependence Treatment Center, AIIMS, All India Institute of Medical Sciences, Delhi. And I am Professor Neerja Chadha, the Program Coordinator. At the outset, may I request Professor T.B. Singh to chair the session, and therefore begin by commenting upon the role of family, both as a trigger factor, a precipitating factor, a relapse trigger on the one hand, and as a support on the other hand, in the context of substance abuse. Sir.
Thank you. The moment we talk about family, we know that any drug dependence or alcoholism begins from social drinking. So curiosity, once they start experimenting, and then indulges in a behavior which becomes chronic and severe problem. The first role of the family is to recognize the problem in the child or adolescent, but in changing society and family setup, usually parents don't have sufficient time to look into these things, and ultimately the problem comes to their notice when it becomes very serious and chronic. In adult people, again, whatever the precipitating factor, stress or reason may be, or social drinking, but it has been observed that lot of effort is wasted. They are cured, they go back to the community, family, and ultimately after relapse they come back. So what are the precipitating factors, what are the relapse triggers, and at the same time, is there any area where family support is lagging behind and person indulges in the behavior again? So this is a kind of national loss. You treat people, you manage them, they go back and again they come after relapse. And then group therapy has been proved to be very, very helpful, and group like Alcoholics Anonymous are emerging, where all people who had been treated and they sit together and discuss their success stories and problems how to manage. So I think with this scenario, the role of counselor at the community level is going to be very, very significant in supporting families and victims of this problem. So with this, I will request Dr. Kaur to throw some light because she is looking after this area in the government.
Thank you, sir. Actually, as he pointed out, and looking at Neerja's question, family as a trigger and family as a support, as far as this problem of substance abuse and alcoholism, tobacco, other drugs, all these things are concerned. If we look at the whole overall scenario, it's generally said that tobacco is the gateway drug. People start from tobacco, which has very high social acceptance in the society, and especially in our country where tobacco is grown, and we are the second largest consumers of tobacco in the whole world. Almost 35% of adult population consumes tobacco in any form or not, and it's the chewing form which is now mainly becoming a problem. Much has been done about the drug and substance abuse and alcohol. A lot of drug dependence centers, programs, infrastructure in the hospitals, and even many NGOs which are working in this field, they do exist at various levels of healthcare. But insofar as tobacco is concerned, because it has a high socio-cultural acceptance, and people don't look at as if it's an addiction, because it's so rampant. Everybody is 35% of adult population, and if you look at the surveillance, the global tobacco surveillance system, which the government has just released the report, Global Adult Tobacco Survey 2010, few days back, and that is showing that a large percentage of 15 and above population, they are using tobacco in the country, and women who have been as per the National Family Health Survey, the last round 2005-6 were just 10.8%. Now it's 20%. And there is one global youth tobacco survey where we look at tobacco prevalence among 13 to 15 years old, and there it's almost 14% of this age group they are consuming tobacco, and the age of initiation is coming down. More young kids, they are taking up to this habit, which is highly addicting. And one more thing which I would like to emphasize is that we don't mention that tobacco is so addicting. Nicotine is as close to as heroin, cocaine, marijuana. It's so addicting. If you smoke, then within 10 seconds it reaches your brain and it leads to chronic dependence. The only difference is if you look at alcohol and substance abuse, your behavior change and other things, they are not that quick. It's a slow killer. The disease, the disability and death, that comes late, and that's why people are not generally bothered. But in India, we say that large number of cardiovascular diseases, lung diseases, tuberculosis and the cancers, 50% of cancers among men and 25% of cancers among women, they are related to tobacco use. So it's a major public health problem which leads to a huge health cost burden also. If you look not only the health burden but the economic burden also to the government. So from my point of view, if we say that it's the gateway drug, we need to have a deeper look at this problem, and we really need to relate it to other problems which it causes. And for example, we in our country, tobacco is a big public health problem and it's related to tuberculosis, and that also is a big public health problem. So if we look at the association between two, it's much higher than the association between HIV and tuberculosis, to which we place a lot of emphasis. But these things they need to be told to people. People need to be sensitized, informed, because at this stage and at this juncture, awareness levels are very low among the general population. And I think Dr. Ambekar will share his experiences with us, because he is at the community level, where he is in direct touch with those people who are addicted to these different kinds of substances, alcohol, tobacco, everything.
Yes, Dr. Atul, I think you are directly interacting with these cases, and based on your day-to-day clinical work with addicts and with this population, will you like to throw light the role of counselor and family support through family therapists, and how that is going to help and its implementation nationwide will really ease the burden which country is facing?
Certainly, sir. Thank you very much. At the outset, we must understand that our country has a huge population, and consequently, even if a small fraction of this population is dependent on addictive drugs, in absolute numbers, the numbers become very huge. So at this moment, as per the available estimates with us, we have more than 1 crore men who are dependent on alcohol in our country. Secondly, we have about more than 5 lakh men who are dependent on various opioids in our country. Clearly, the existing drug treatment services which we have are not sufficient, not enough to be able to cater to this huge treatment demand. So we need more and different variety of service providers. Now we must understand that substance use disorders, drug dependence or drug abuse, they are seen as biopsychosocial disorders. So while there is a definite biological component, which means the medical fraternity has to play its role, there is also a very large amount of problems which could be served by employing effective and trained manpower in the area of psychology and social work. So counselors, particularly counselors in family therapy, could be of great help in this regard. For instance, how can a counselor help in the area of substance use disorders? As it was rightly pointed out by chairperson also, that most problems begin in the family itself. So counselors, the family therapist, by providing care for the existing mental health problems in the family, can keep the mental health environment of the family at a very healthy level, and thereby they can help in preventing the initiation, the onset of substance use itself. Secondly, the counselors or family therapists who are in regular touch with the family, they could very well provide the early detection services. We all know that for all kinds of illnesses and disorders, if they are nipped in the bud, so to say, if they are identified early and provided treatment very early in the course, then the chances of recovery are very high. So that's one another angle in which counselors can provide a very valuable role. Lastly, when patients are actually on the severe stage of dependence and when they are getting treatment from a medical professional or from a specialist for treatment of drug dependence disorders, these counselors can aid in that process by ensuring that the person is compliant to the treatment and the relapse for these drugs can be prevented through the use of such counselors. So I believe in these three different ways, counselors can provide a very comprehensive range of services for substance use disorders.
Thank you, Dr. Ambekar. The statistics you provided really lay the foundation, because very often the problem becomes evident only when you get concrete evidence of the magnitude of it. One gets tempted to think of solutions only when the problem seems to be worth the effort. And in terms of the statistics that Dr. Ambekar has provided, the problem does warrant serious attention of professionals and policymakers in the field. But out of curiosity, you've mentioned 1 crore men. Similarly, whether it was for drug dependence or alcoholism, is it that these problems of substance abuse and drug addiction are more in the case of men, or it was more a manner of speaking that this many individuals in the country?
The statistics which I was quoting were from a survey which was done exclusively among men. It has been well accepted in the country through clinical experience as well as various small surveys also, that the proportion of women who use various substances is relatively, comparatively very small as compared to men. So it's the men folk of the country who are bearing the major brunt of this problem. But yes, substance use among women does also exist and it needs to be addressed.
Yes, if it's not alcohol or other substances, other drugs which we call, but tobacco is different. See, as far as tobacco is concerned, and as I said that because of the social acceptance, because it's accepted in the society, women do consume. Although in India, I mean, unlike in the West, smokers are less. And it's more among the urban women, and some of the rural women who smoke BDs and use other traditional forms. We are unique. I mean, India is unique in the sense that we have such a large number of tobacco products in use in the country that no other country in the whole globe has this kind of problem. While the developed countries, they have tackled with this problem, they have only fought with the cigarettes problem, and now their prevalence is coming up. We are in the second stage of tobacco epidemic. Our prevalence is going up, the deaths are going up, and now that the prevalence among women, which the Global Adult Tobacco Survey India is showing, that's really a cause of concern and calls for an urgent action. And what women do, in our country, they use the local products, and mainly among women, the chewing forms, the pan with tobacco, and also they apply different kinds of tobacco products which are locally called mawa, gul, mishri, bajjar, and even tooth powder which contains tobacco. So out of ignorance, they keep on using, and then they get addicted to it. It leads to chronic dependence, and that needs treatment. So once the question of help comes, when it's dependence, when you get dependent on something, for example tobacco, then the role of professionals comes, and it starts from the behavioral counseling. The first and the foremost is the counseling services which are provided to these people who are used to tobacco, alcohol or drug dependence. We start with that, and there, as we have said, that there is a shortage of trained counselors in the country. This course, this provision of these people, the counselors and the family therapy, the support which is required at the family level. We always say that when somebody is preparing to quit, he has to inform his family, okay, I've set a quit date and I'll be quitting from this date, and he announces in friend circle, family, so that support is required. So there comes the role of the family, and given that the chances of quitting are much more, And as with all the substances, alcohol, drugs, tobacco, the rate of relapse is very high. People do try to, again and again start using this, they leave it and then they again start the use. So it becomes a real challenge for the person who's treating such cases. And the counselor's role, we say that for tobacco, even if a counselor or a health professional or even a health worker gives a brief advice, we say that 3-4 minutes advice to a patient or the user who comes to him in clinical settings or in the community settings, that really helps. Once even if you start with relating the symptoms, when the patient, for example, presents with the chronic cough and he's a smoker, so that can be related that the symptoms you are getting because you are a smoker or you are having some oral lesion which can ultimately be a oral cancer, that is because you chew tobacco. So that counseling becomes really important for that fellow. And if you repeatedly ask him or her when that patient comes to you for caregiving, then that goes, that makes an impression into the mind that, see, I have to quit this habit because it's not good for me. So spending that little amount of time with that patient really goes a long way, and we really need counselors for this, because to start with, once this is just becoming a habit, and at that time only when we act, we are able to provide help, the professional help by the trained professionals, and then you can save them from becoming the chronic addicts, and then so that that it becomes very difficult at that stage. So diagnosing them and providing them timely help is of, I think it's of utmost importance in such cases.
Dr. Jagdish has really raised very valid points that if you manage to strike the iron when it is hot, when the person is presenting himself with a physical complaint which obviously is bothering him, and at that time if you link it with the something that he's got habituated to, the substance abuse aspect, then you have kind of made an intervention at the right time. Would you like to comment on, therefore, how counseling and family therapy by even medical professional can make a positive intervention in the case of substance abuse cases?
Basically, ma'am has very rightly put that counseling is of utmost importance. In fact, what has been happening in our country is the health damage related to tobacco has been receiving some attention, at least now, but tobacco as an addictive substance is relatively receives less attention, and hence, as madam rightly points out, we need to develop counselors who can have specific skills to deal with substance use disorders, including tobacco dependence. About the question of whether physicians can take this task of counseling or not, unfortunately, at their training stage itself, most of the physicians are not trained adequately in counseling in general and counseling for substance use disorders specifically. So perhaps some curricular changes could be made so that the budding physicians themselves have some degree of at least knowledge and skills to be able to help people with substance use disorders.
I think two more significant things are evident, which should be known and it's prevalent in the community. The first thing is there is some cultural input available to the addictive behavior. marijuana शिव जी का बूटी है होली के टाइम में. So looking into that the cultural input part. The second part is, the second aspect is drug dependence and alcoholic is not an exclusive problem in itself. It's a group. But in the various other clinical groups we see the problem is associated, you can say, dual diagnosis. So based on your experience, Dr. Atul, how you look at these two problems, the problem of addiction with dual diagnosis for the benefit of counselors, as well as to ensure that the cultural input of addictive behavior is not exaggerated unnecessarily to go into the level of dependence.
About the dual diagnosis, which means when people have a mental illness and also addiction or abuse of some or other psychoactive substance.
Sorry, I'm interrupting. For example, personality disorder cases.
Right.
Bipolar affected people.
Right.
We find there is some degree of indulgence in addictive behavior as well.
Right, sir.
So
Absolutely
looking
right.
into those problems.
Absolutely
which
right, sir.
diagnosis
Absolutely
have.
right, sir. So when people have, it presents a double dilemma for the person who is providing help or care. Number one of the dilemma is which of these problems, the mental illness and the associated substance use, should be treated first. Second dilemma is about which has caused what. Has substance use caused mental illness, or has mental illness caused substance use, or are both of these due to result of a third condition? Yet another dilemma is, if I treat one and person continues to experience another, what would be the effect on treatment? For instance, if I am giving him medications for depression or some specific advice for depression and the person continues to use alcohol, what would happen to his treatment of depression? So these dual diagnosis cases present some special challenges in this regard, and the service providers, be them physicians, psychiatrists or even counselors, need to have a specific skill set to be able to deal with these problems. We hope that with adequate level of training and education, we should be able to develop a cadre of trained people who will be able to deal specifically with dual diagnosis issues as well. On the issue of whether to what extent is culture responsible, yes, we have had in this country a very long culture of socially sanctioned substance use by specific groups of people in specific context under specific situations. However, as the history of our country tells us, thus socially sanctioned substance use rarely went out of hands, which means it remained controlled by and large to a specific groups of people. It rarely led to a degree of problems which we see right now. So those with the advent of the modern science, the advancements which have been made in terms of purity of substances, in terms of transportation of these substances, thus has changed this cultural substance use altogether. So people who were earlier using occasionally, say, opium because of cultural and ritual use at in some parts of India, they have gradually now become dependent on harder drugs like opium. So the culture definitely has had a little part in contributing to substance use disorders, but the dimension of the problem which we see right now is, I don't think that culture is playing a too big a role in that problem.
Doctor, sorry.
Just a comment on what he has said. That's a little different for tobacco, I must say, because if you look at some regions of the country, for example the northeast region and the eastern region of the country, where it forms a part of the cultural, it's a part of the socio-cultural milieu. You offer tobacco, the pan with tobacco, if somebody comes to your place, like in North India we offer tea. So taking it out from there, that needs behavior change, because it's embedded so much, and all these states have 50 to 60% of prevalence of tobacco, which is too high, and high prevalence among women, kids taking up tobacco use so early. They have different forms of tobacco. For example, Manipur and Mizoram, they have tuber, which is tobacco water, and many of the people haven't even heard of such things, but that's because of culture, because it supports them. And now you require BCC, I mean behavior change communication, for that, where you need trained people. For that you need, there comes the role of the counselors and the family therapy, and you have to explain it to them. See, even if it's a part of your culture, it's not good for so many things, for the health, for the family economy, for economy in general, and the environment. If you go into the various aspects of tobacco, and then it becomes into more harder drugs, it becomes, then the substance use comes, the alcohol and all those things, it become a vicious cycle. So there it's a bit different, and we have seen over the decades the high prevalence remains there in the eastern region, and because of this socio-cultural aspect.
Dr. Atul had pointed out about substance abuse being essentially a biopsychosocial disorder, and an increasing recognition of this dimension, this aspect, or this characteristic. And Dr. Jagdish, you yourself have pointed about the inputs provided by the socio-cultural milieu to the continuation, the inception and the continuation of substance abuse in particular regions. Now, having recognized the socio-cultural inputs, to what extent has this been taken cognizance of at the policy level in terms of the national level programs that we have to address these issues in terms of providing services and creating infrastructure, including provision of manpower services in these, the human resources to deliver the services, the professionals engaged in these programs to tackle these problems at the ground level?
So, at the national level, we have a drug de-addiction program, and we have a network of almost 125 centers, de-addiction centers, which are supported by the government in different parts of the country, and also under the National Mental Health Program, the component, the District Mental Health Program, where this de-addiction services, they are provided at the district level, and various medical colleges, psychiatric wings of medical colleges, then the mental health institutes and general hospitals where the psychiatry wing is there, they all provide de-addiction services, and this network is there all over the country. Besides that, the Government of India started National Tobacco Control Program specifically to focus on the problem of tobacco in the country, because it's huge. If you look into numbers, like if I say 35% of population of India, then it goes into more than 35 crores. So that is the problem, and to look at that problem, every one of us, and being a health professional, has to be a counselor besides the specialized people. But it's the survey also said, the Global Adult Tobacco Survey, that the health professionals, they so few of them were even asking about the tobacco use habits of people and then asking them to quit. So everyone has to be trained. When the patient comes, he has to be asked about this. I don't know, when we are trained, we are taught all these things and later on tend to forget or what, don't ask. But the curriculum, as Dr. Ambedkar pointed out, it's lacking. They are the medical graduates, the dental graduates, nursing personnel, they are not taught much about this aspect. There is something about substance use and alcohol, but tobacco is completely lacking. And you look at the problem, the size of the problem. So how that's going to be tackled? We are also looking at the curriculums now. We are trying to put it into the training of the graduates, the medical, the dental graduates. We are trying to train already, trained people. We are trying to train our health personals who work at the grassroots level, trying to train doctors so that they can take care of this problem when it is, glaring at us in such a huge proportion. So that is what the government's initiative has been, and we are also now trying to integrate this, the help at various levels of different national health programs. For example, mental health program, it is there in some districts, and now this new diabetes mellitus CVD program is coming there, and national cancer control program, because these are the risk factors for non-communicable diseases. And then association with TB, 40% of TB deaths in our country, they are related to smoking and tobacco use. So such a huge association. So the TB program has a good infrastructure right from the center to the grassroots level. There also we are trying to pilot test certain projects where we can train the TB professionals, the health professionals, so that when persons come and tuberculosis patients and they have history of smoking or tobacco use, then they can provide this counseling to the person and say, okay, your problem is related to this, so you have to quit. So those kinds of initiatives also the government is taking by integrating into various mental health programs. Even HIV/AIDS, HIV/AIDS, TB, HIV/AIDS, smoking, all these, TB, smoking, all these are vicious. And if you look at the network of ICTCs, we have more than 5,000. There, if we integrate the counseling for tobacco and alcohol and substance abuse also, then that becomes a good infrastructure which is available, at the ground level, where people can take use of. And first and foremost, you have to realize that it's a problem and you need help, and you need to seek help, and then somebody should be there to provide it. So it's both sided.
Thank you, Dr. Professor Singh, I would like you to shed some light on the fact that most of our interventions at present are based on pharmacotherapy. We address the problem of substance abuse basically through this approach. to what extent do you think that supplementation of it with counseling and family therapy could play a constructive role?
Yeah, the constructive role of non-pharmaco method is very supportive, because the precipitating factors, if you concentrate, that are basically, I mean, as I said, it begins from social drinking, some kind of frustration, disharmony in the family, economic distress. So there are various precipitating factors, various reasons of indulging into this kind of habit. So to ensure and to know this pattern and identifying and helping the person as well as the family is going to be helpful. The second thing is, group approaches have been proved to be very, very useful in managing the alcoholic problem as well as drug dependence. In Western countries, a lot of therapy is going on with the group, 7, 8 people, 10 people, and being dealt with together. Then third approach, I mean, it's all emerging like Alcoholic Anonymous group, we say. The people who have been able to come out, they sit together, they discuss, and that's also helping. And then we are talking about awareness and early identification. If that goes to the families and community through counselors, I think families will be assisted, and that's how there is a lot of psychological awareness. And with this psychological awareness, we need to encash upon, so that these psychosocial methods are helpful in managing this problem at the family and community level.
Thank you. And now, as we are almost nearing the end of the session, may I request the panelists to make a brief summative statement, the key points that they would want to drive home, put across, in the context of the potential of counseling and family therapy, in the context of tackling substance abuse, the role that a counselor and family therapist can play right from the stage of detection through relapse prevention and rehabilitation. Shall we begin with Dr. Ambekar?
Yeah, sure. As I said earlier also, substance use disorders should be seen as encompassing all three dimensions: biological, psychological and social. So a person who is providing services in this area needs to be aware of the role which all these three factors could be playing in the genesis, in the maintenance and even in cessation of substance use disorders. So a counselor needs to do well and needs to be able to have skills in all these three areas to be able to deliver effective services. And secondly, one more thing, the awareness generation is a two-edged sword. I mean, if we generate awareness among people that you are suffering from an addiction, but we are unable to provide adequate services to deal with that addictive problem, then that becomes a big problem, and then it's difficult to save our face from the affected groups. So we need to back up the awareness with the plans and delivery of services which can effectively deal with treatment of substance use disorders.
Dr. Jagdish?
So besides this demand and supply issue which Dr. Ambekar has just stated, that once we create a demand in the society, we make people aware, okay, you are addicted, this is a problem, you need to quit. So then we need to provide the service, we need to have people who will be there. And there is a gross shortage of all these services, the infrastructure which right now we are having in the country, because if you look at the number, the kind of prevalence we have, we need lot more in that area, lot more support at every level of care, not only that at tertiary level or higher level, the hospitals at the district level. It has to go down to the community so that it's available at the nearest level of care. And even at home, some countries have the quit lines for tobacco, where you don't have to go anywhere, you just ring up, and then they have the counseling sessions, they are placed at different like weeks apart, or they'll give you a schedule and then you call again, and it's 15 to 20 minutes counseling session, and you call at your layer and you can make that schedule in discussion with the counselor. So that kind of services if you provide, then that removes the stigma, especially the people who are addicted to tobacco or using substances or alcohol, the young people, and especially when they don't suffer from any other illness, any comorbidity, like I don't have any problem, I use all this, but till now I haven't developed any disease or disability, so I won't be going to a health facility for this help. So if such kinds of services are available, they are much easier to use, and the quit rates are very high with that, and they have been very popular in other parts of the world. And one more thing I would like to emphasize here is, besides this treatment part, besides this part where we are helping those who have already taken up to the substance use or tobacco or alcohol, these counselors will also have a major role in preventing, in educating people, in educating the community that these things are bad, and once this you take up to this, these things can happen. So that education part also will be there, which will be very helpful in providing an overall care to such people and service to the community.
Thank you, Dr. Jagdish. Now, summative comments from the chair.
Yeah, I look at this whole issue as reaching the unreached. And if you take the semi-urban and rural areas, lot of services are required. Early identification to helping people at different stages of this problem, and then rehabilitation, helping families, assisting families to look into this whole problem, and then generation of awareness and attitudinal change, because attitudinal change will help in preventing relapse, because the stigma is there, person is addict and he cannot be taken care of, he is a gone case. So these are some of the significant issues I am hopeful will be addressed and will be looked into with the efforts of these counsellors who will be trained from IGNOU.
So, thank you. I guess we could aptly sum up the sentiments which have been expressed by the esteemed panelists from various institutions who've had decades of experience in handling these problems at the macro level and the micro level, the day-to-day contact of people who have been suffering from substance abuse and trying to get them out of it. As the chair, Professor T.B. Singh rightly pointed out, the time has come to reach the unreached. Dr. Jagdish enunciated how, because of the cultural support and the support from the social milieu, many of these are deeply ingrained in the psyche, in the social practices of a country. And you do need the awareness generation aspect to be strengthened to help people first become aware of the problem. And as Dr. Atul pointed out, once you have made the person aware that there is a problem that he should be getting out of, you have to provide the support services to help that individual get out of the problem. And very often it's not just the individual. For example, as was mentioned, if the man and if the husband is alcoholic, then the wife and the children are also suffering from the effects of that alcoholic problem of alcoholism. So very often, and it was also pointed out that if the person announces to the family, then the family can be geared up. In fact, the counselor and family therapist can help the family gear up to help the individual, the family member who's trying to give up the habit. It was also pointed out that why later? Prevention is better than cure. Why just attend to the problem after it has occurred? It is also important to empower the families so that the problem is handled before it has actually become a major problem. While it is still at the inception stage, if the supportive mechanisms get activated, the person needn't get into the habit of substance abuse, and therefore the problem needn't occur. So right from prevention stage to relapse prevention and making the person get rid of the habit, we need counseling and family therapy support to be provided at all levels, from primary to tertiary levels, to help the population, our nation's population, get rid of the substance abuse problem. And with this, thank you everyone.